Welcome to Herbally Yours, an adventure into the world of natural medicine. Here is your host, Dr. Ellen Kamhi, the natural nurse who will help you take the leap to ultimate wellness.
Greetings, and thank you so much for joining us today. This is Ellen Kamhi, the natural nurse, and we're here for another edition of Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. Herbally Yours brings you the latest information about the many facets in the world of natural living. And today we're going to be talking about dental care and other things that are related. And we have as our guest Dr. Marcia Greene. She is a DMD, a practicing dentist in Staten Island, New York, so she is local. And on today's show, Dr. Greene will discuss many different aspects of dental care, including sleep apnea, and how the correct dental approach can support those who suffer from this issue. And you can find her at BayviewDental736.com. Thank you so much for joining us today, Dr. Greene.
Much for having me. You're absolutely welcome.
Now, I believe were you part of the Naval Expo? And
yes.
they give lectures both in New York and also Long Island.
Yes. I did both.
I saw that because the Naval Expo, and anyone can find that at navalexpo.com, and that happens twice a year locally here, so you can check that out. Features many top-of-the-line healthcare providers who are interested in a natural approach. So that's where I came to reach out to you, Marcia Greene. But let's go back a little bit in time and tell me, why did you want to become a dentist, and how did that happen?
Oh, my goodness. I have to tell you my age. I went to Fairleigh Dickinson University. I was always interested in healthcare, but dentistry was just a natural progression from being a bio major to dentistry. Just interested in working with people, being an artist. And they had a dental school, and I just became interested in at least pursuing a further education beyond my biology degree. Nothing specific, just wanted to keep going to school.
It was a path, like a professional path that sort of opened up for you.
Right. There was opportunities, and I just took them and passed the test and kept going.
So you've been a dentist many years, I know. That's not a new thing for you. But you seem to be always evolving into new areas that might be addressed by dental care.
That is correct. My interest in my evolution to sleep apnea actually came up with periodontal disease, which is gum disease, loss of teeth due to poor health or poor bone support around the teeth. And I noticed in treating my practice is mainly females, so in treating some patients who had particular patterns of bone loss around the teeth, was not being the treatment that we're doing dentally, the dental modalities, was not curing the disease. It was not working. And I would occasionally tell a patient, get a blood test. Let's see, this doesn't look normal. It's not responding to the normal course of treatment. And invariably, these patients will come down with breast cancer, some type of ovarian issues, and I started to take a further look. One particular patient she was 42 years old, and I kept telling her for 2 years to go to the dentist, go to the medical doctor, get it checked. She didn't go. When she finally went 2 years later, she was pre-leukemic. And I remember very clearly I was reading the newspapers and noticed her name in the obituaries. She was 42 years old. And I am always since then looking for what is causing this periodontal disease, why are patients losing their teeth, and that its relationship to cancer and to just systemic diseases. So sleep apnea is a natural evolution, or sleep disordered breathing is a natural evolution from my work with periodontal patients and the systemic diseases that follows.
So that's an interesting link, and I think many people don't even realize how closely related oral health is to overall health.
Right. Well, it starts deep in the system, in the liver, particularly liver and kidney. If you're showing up with periodontal disease, I look at digestive system, look at the liver and kidney issues. You'll find that somewhere you're correlating up to diabetes, hypertensive, all the metabolic diseases. But a deeper look would lead you to some type of sleep-disordered breathing. These patients are grinding their teeth. They have acid reflux. You have an erosion of the enamel of around the teeth, and overall they're getting more root canals, more dental work being done because of initially of grinding and weakening of the structures, and that's coming from something systemic, not just dental.
Well, Dr. Greene, define sleep apnea for us. What exactly is that?
Sleep apnea is when you're sleeping or you have a disruption of sleep. It's interrupted sleep due to grinding of the teeth, and you lose oxygen to the brain 10 seconds, 30 seconds intermittently throughout the night, because you're not able to breathe. Your tongue is blocking the airway, and you're not able to breathe correctly, so you don't sleep well. You're constantly up, and you're being compromised. So that leads to an inflammatory process in the body. And every disease pattern that you could think of is derived from reduction of oxygen flow to the cells and tissues.
And I don't think people know, as a rule, how interconnected their entire body is to some kind of thing. Now, would somebody know if they had sleep apnea, or would it have to be diagnosed?
Some people do know that something is not right, that they don't sleep well. They may have insomnia. Some people in New Yorkers, we're not sleeping. Okay, we're all up doing something. But some people know that they have a shortness of breath during the night, and that their partner, their bed partner, will certainly tell them that you're not sleeping, you're keeping me up. They can't sleep. So both people are affected if you have apnea, or some kind of sleep-disordered breathing is really the correct term.
Now, what we see on TV all the time is when people have that issue, they usually have this device that they actually wear at night.
It looks like a space mask or space something. That's called a CPAP. It's called a CPAP. It's a positive air pressure. It puts positive air pressure into the lung, allowing the patients to breathe better. But that's only for the night. And it doesn't really train the breathing. It does help them to breathe better, and patients do get a good night's sleep. But you've got to have this mask, and it does work in severe cases. You do need to have that mask.
So you find that might be helpful, but it's not going to fix the problem. It's just palliative.
Patients are not necessarily compliant. If they don't feel that their symptoms are severe, the men, it's not very sexy, let's face it. So it depends on who your bed partner is or what is going on in your bedroom at night. You may not use it, and compliance is a big issue. That's where the dental component comes in, because there are dental appliances that are much more compatible and easier to use.
Well, good. We'll speak about them, but I would like to remind our listeners that you are listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. I'm Ellen Kamhi, the natural nurse, and today my guest is Dr. Marcia Greene, and she is a dentist, and her best website is BayviewDental736.com, and among many other specialties, she has a specialty in sleep apnea, and that's what we're discussing today. Now, how common is sleep apnea, Dr. Greene?
Right now we're looking at 40 million undiagnosed. They're saying 18% of males, 10% of females are undiagnosed or have it. And in children, it's a big factor. Children is my main concern at this moment. So it is 40 million out of a population of what we have, 350 million. That's a significant amount of people that's undiagnosed.
Now, is obstructive sleep apnea the same as sleep apnea?
Obstructive is really severe, and it's a part of sleep apnea. I think the term that I like to use is sleep disordered breathing, because under that there's sleep apnea. There's just patients who don't sleep, or in general they're over breathing, or they're breathing too rapidly. So the breathing needs to be corrected, because if you're breathing rapidly 24 hours a day, your lung doesn't take in enough oxygen, and it doesn't get processed enough, or it doesn't have enough time at the base of the lung to exchange the CO2. So the blood doesn't do enough uptake. A little bit of scientific, but the blood doesn't do enough uptake of oxygen throughout the day, so your body's compromised. So that's where your disease factors come in.
So it's very interesting that yourself, as a dentist, where does the connection come in between dentist and something like sleep apnea?
Well, we're the first in line to see it or recognize it. Most patients will see their dentist hopefully twice a year. You start to see a weakening in the teeth around the roots. The patients complain of sensitivity, or they're getting too many fillings at the base of the teeth, between the base of the tooth and the gum, right in that what we call in dentistry class 5 restoration. It's a weakness of the teeth due to grinding. The second pattern we'll look for is the teeth are wearing away. The front teeth, the patient starts to wear them away, or they're chipping, and uncontrollably slow. Breakage of the back teeth, just the teeth are fracturing in half, or a piece of it is broken off, and you're constantly doing root canals on the same patient, is an indication that the patient may have what we call nocturnal grinding. And
so they come to your office and you see these particular patterns, and you, as a trained person, go, gee, I imagine they may have sleep apnea. That would cause some of these health issues.
Well, we don't diagnose it. We would have to refer them to a physician for a sleep study. That's what I do. And we would it's an indicator. We get a sleep study, and from the sleep study, we would look at how the patient is breathing at night. It gives you certain indices, and you would look at, depending on the numbers, whether they're mild, severe, or moderate. Mild and severe, we can treat. Severe, the physicians would certainly indicate a CPAP machine, at least as part of the treatment.
And so you would work with a physician to complete the diagnosis. And then what kind of care could a dentist give in this situation? The
dentist can use their multi-pronged approaches. So the physician would do one part. They can also do an appliance. We would have what we call hybrid therapy, if it's indicated, where we would give the patient a dental appliance that they can use along with a CPAP. And also there's a nutritional component that either the physician or the dentist, if they're trained, can implement. But it's a multi-pronged approach for sleep apnea, because most of the patients that have sleep apnea are obese. They have some kind of
that's a whole new thing.
Right.
Just recently, of course, we've always known obesity is linked to various kinds of long-term illnesses, but the scientific evidence of that is definitely increasing. That's true. So that's where the nutritional component would come in. Well, we're going to take a little break right here, Dr. Marcia, and when we come back, we're going to be continuing our discussion. And I'd like to remind you, listeners, that you are listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. Listen live online at nccradio.org or on iHeartRadio. For more information on today's guest or topic, email us at whpc@ncc.edu. Stay tuned. Herbally Yours will be right back.
Melissa from Michigan. I work an extra part-time job serving lunch at my child's school, but I still can't afford to put food on our table.
Daniel from California. Choosing whether to pay the rent or pay to fix the car to get to work doesn't leave us with much at all. Now we can't even pay for meals.
Hunger is a story we can end. End it at feedingamerica.org. Brought to you by Feeding America and the Ad Council.
3, 2, 1. Oh no. Which button am I...
When every second counts, you can't wing it.
Guys, a little help up here?
In a home fire, you may have less than 2 minutes to get out. So make a family home fire escape plan. Then practice home fire drills at least twice a year so everyone knows what to do when they hear... Prepare your family at ready.gov/fire drill. Brought to you by FEMA, the Ad Council, and Make Safe Happen.
And welcome back. Thank you so much for joining us right here on the voice of Nassau Community College, 90.3 WHPC. I'm Ellen Kamhi, the natural nurse. And today, my guest is Dr. Marcia Greene. Dr. Greene is a practicing dentist in Staten Island, New York. And on today's show, we're deeply discussing the concept of sleep apnea and how the correct dental approach can actually be very, very helpful on suffering with this issue. So welcome back, Dr. Greene.
Oh, thank you.
And we were talking about sleep apnea. You described the fact that it's very common. And then you brought in the concept of it's linked to obesity. So do only obese individuals suffer, or is it more broad-based?
It's more broad-based. We look at what we call the big fat guy, or the FBG, and you say, oh, he definitely has apnea. But the slimmest of persons will have apnea as well, equally. So it's anatomical in one sense, in that as children, if you have crowded teeth, the palate is not formed optimally, so the tongue does not have enough room just enough space in the mouth to allow for the opening of the airway. So the tongue will block the airway when you sleep. Enlarged tonsils, enlarged adenoids will cause apnea as well in children, specifically in children.
Well, in the old days, and that's where I'm coming from, almost everyone had their tonsils and adenoids removed across the board. But that seems to be not as common these days. Not as common anymore, but they're still doing it now because they're children. I've had maybe 2 or 3 children in the last 2 months who were referred to have their tonsils out because the children were not breathing properly and not developing well. So that's still coming up. Yeah, that wasn't fun. I had that done for no reason. I mean, it just seemed to be the vogue thing in those days. Right, but now we have dental appliances that can actually shape the palate as the child is growing to allow for better airway, better airflow. Oh, that's a good idea. Now, you did bring up, Dr. Greene, you brought up nutrition. Yes. And that might have been, for some people, why would a dentist be talking about nutrition? But really, there's so many reasons why all dentists should be talking about nutrition. So why don't you talk about that, please? I think dentists are trained in nutrition. We are trained in nutrition, and we're very much aware on nutrition and its impact on teeth. But in terms of periodontal disease, in terms of sleep disordered breathing, we're always looking at I look at leptin because I do some holistic work. Leptin, ghrelin, the correlation between the two, those are weight management hormones. Oh, leptin, I'm going to ask you to go into those because I have written several books and talk about them in depth, but not everyone has heard about them. Ghrelin and leptin, two important terms. Right. Leptin is what gives you satiation. It tells your body that you're full. So if you have a leptin is also in correlation with decreased amount of sleep. So if you sleep duration. So if you have a decreased leptin and you don't sleep, if you have decreased sleep, you sleep in short bursts, usually your leptin is low and your ghrelin is high. So there's an inverse correlation. Leptin. If you decrease in leptin, you're always eating. You feel like you're not full. You're never full enough, so you keep eating. Your body tells your brain that you're starving, basically, if you don't have enough leptin in the body. So that's one of the biggest keys in where you find your obesity and your sleep apnea. You don't sleep well, you're always hungry, and you're always eating. You can't control your appetite. So it's linked to the balance between those two hormones, which are really brain signaling mechanisms. That's right. So that's why your stomach is your second brain, because the one brain is telling the other brain that it's hungry, and there's no control. And what kind of link would there be in terms of that, the ghrelin and the leptin balance and nutrition? Well, if you're always hungry, they tend to pack calories, not pack nutrient-dense foods, right? So you're not eating the healthy foods that would increase your leptin uptake. Leptin you can take as a supplement. I'm not sure how effective those are, but just eating fresh, healthy foods, or what I call live foods, is going to give you your body better balance because you're going to have decreased acidic pH balance in the body. You're going to have a better pH balance if you're eating well. Anti-inflammatory, so all the basic, what doctors say, eat an apple a day, whatever, vegetables, fruits, fresh foods in their natural state, you're going to balance all the hormones across the body. Right, and that sounds simple, and it really is simple, but I call it paragraph-free eating, which means if I open my refrigerator or even my cabinets in the kitchen, there's not one single thing there that has a paragraph on it. What does that mean? That means nothing packaged, nothing processed.
That's right. And most people aren't going to do that. But I tell people do a progression. I ask them to start with maybe just making a smoothie once a week and put what you like in it. Just make sure it's fresh. Don't buy frozen. Get fresh fruits. Put a little handful of those spinach or organic green leaves in it, and put some fruits and mix it up. It's a fresh thing, and drink it right away. Start once a week, reducing some of your meat intake, at least the junk foods. Take one thing out per week, and you will eventually get there. But trying to stop, and I'm not going to do anything but fresh fruits and fresh vegetables, if that's not what you're used to, that becomes very difficult, and it becomes like a diet.
Right, that's challenging.
Right, as a lifestyle change. You're not going to do it overnight. You're going to take your time and move forward, and have a reason to do it. If you have a big why, then you're going to do it.
Well, I want to remind you, listeners, that you're listening today to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. I'm Ellen Kamhi, the natural nurse, and today my guest is Dr. Marcia Greene, and she is a DMD. She's a practicing dentist in Staten Island, New York, and has been discussing very interesting aspects of food, nutrition, and sleep apnea from the dental perspective. And thank you so much for being our guest today, Dr. Greene. Now, you mentioned very briefly some word, and I'll repeat it so you can help explain it to our listeners, when you talked about an appliance that might also be useful, both when used in children during growth and I imagine in adults as well. Right.
Well, we can start with a basic. People know what a night guard is, but I would get a customized night guard. We take an impression of the teeth, and we have a night guard made up, or what we call a splint. That simply slides between the teeth at night, goes over the teeth, and you're able to keep the teeth slightly apart. And when you grind at night, the poor teeth are not taking on the pressure. It's actually going towards the appliance. That's one very basic thing that we start with. The next thing is, and based on your sleep study, if the patient's had a sleep study, we can look and we can, based on lifestyle and what the patient actually needs, make their different appliances that will move the lower jaw forward at night when they're sleeping and open that airway. So those are the patients who can't use a CPAP, don't want to use a CPAP. There are a variation of appliances that can be used, or what we would call a retainer, what people would call like an orthodontic retainer that can be used.
Okay, so a retainer is often used after braces.
Right.
People might be familiar with that.
An appliance something like that, except it covers both upper and lower, and it's usually made together. So the patient puts it in, it moves the lower jaw forward, and most people, when they get used to it, they stop snoring. They can breathe easier, and when they wake up in the morning, they really function better.
So would they use that instead of a CPAP or along with a CPAP?
Some, depending on the severity. It's usually worked with both in conjunction with the medical doctor and the dentist. If it's mild, we can do it you can use an appliance on its own. If the patient is obstructive, severe sleep apnea, then they need a CPAP and maybe, like I said, a combination therapy in different stages. You may not use both at one time. But the whole idea is to work the patient from one stage to the other.
You know, that's actually an interesting concept that seems like it should be actually a normal concept, which is a doctor and dentist working together.
Right. Not very common because, again, in American medicine, Western medicine, everything is fractured. And there's some groups now that are coming together and realizing that they can't do without the other. So there's some dental medical groups forming alliances together so that we can have it done. I'm actually doing that myself, working with the medical group to get better results in one place.
Oh, actually, that's an excellent idea.
Right, because you really can't do it without each other, but the medical people are just finding that out, so they're coming. We're both merging in some aspect, at least on one platform, to say what are the parameters in this patient's health that need to be treated and moving them towards a certain outcome. And
yeah,
the
and
patients
especially
have input.
because when you're, involving the whole body and you're talking about nutrition, you need to have a doctor who's on board with that also.
You need to have a team, and the patients, I think, should progress from a CPAP. Most people have a CPAP for life. My personal philosophy is that I don't believe in a disease for life. I don't believe in diseases, period. But disease for life does not make sense. It's not health. If we're believing in health, then you should move the patient back towards normal, optimal health.
And so many people that I've worked with, various clients who have been on CPAPs, they do not continue to use them.
No.
They get annoyed, and then, of course, on TV they're showing that they're actually a reservoir of bacteria,
right?
Because there's moisture in the machine. So what about that?
Certainly have no thing. CPAP does have its place, and it should be, the direction and the guidelines should be followed. The bacterial aspect of it is not new. It's always been there. They just found a solution for it, and I think we should follow the medical guidance on it. If the patient needs a CPAP, they definitely need it, then continue. But at some point, my personal thing is that they should be weaned from a CPAP.
So through something like breathing. Diet, exercise, holistic therapies.
Breath training. Teaching the patients how to breathe breathe normal, healthy breaths, not overbreathe or not taking enough breath. And it's lung health. There's such a thing as cleaning the lungs. Through breathing, you could breathe in through their machines that you use to actually cleanse the lung. With a little bit of water, and you cleanse the lungs. People use oils and that kind of stuff. I don't use anything like that. But it's like an athletic training camp, or teaching how to swim, endurance. You can actually train your body to breathe better.
Right. I guess first you have to recognize and admit that there is an issue, and then you can look into solutions. And
it takes 2 minutes to learn, just 2 minutes of breathing, taking in a breath against a little bit of water at the base of this simple little dynamic machine. And a couple of minutes a day for a couple of weeks, you're breathing normally. So you don't only breathe at night on this machine, but during the day when you're most active, you're taking simple, natural, healthy breaths.
Right. I've seen those machines in the hospital as a nurse in people who have had things like collapsed lungs, and they use that as retraining. But it does seem just such a simple thing that people could use even at home.
Health is simple, isn't it? If you really look at what it takes to make you healthy, to stay healthy. If the whole country was, I think we are now on a health trend and preventive trend as opposed to treating a disease, I think health and preventive would win. But it's not very profitable.
Oh, well, that's a topic for another day, which we will have another show together, Dr. Marcia Greene and myself. But Dr. Greene, for today, I want to thank you so much for being our guest here on Herbally Yours. Is there an ending statement you'd like to tell our listeners?
Thank you. Sleep well, eat well, and be healthy. Breathe easy.
Well, thank you so much. And thank you for tuning into Herbally Yours, produced in the studios of 90.3 WHPC, Nassau Community College, Garden City, New York. For further information, email us at whpc@ncc.edu. This is your host, Ellen Kamhi at naturalnurse.com, inviting you to join us next week for another edition of Herbally Yours. Until then, stay healthy.